untangled and cared for until it no longer does. Reminds me of How to Train Your Dragon. You need to stop all this. You just gestured to all of me. Yes. Stop being all of you.
So 4 years ago, I was having issues down here with my lower back, and I did that from lifting weights, squatting and deadlifting repeatedly.
Yeah.
And I got super sore. Then all of a sudden, the soreness never went away. And then that was actually a year before I got the MRI, so I let it kind of settle for a year.
17 starts.
Yeah, and it did start to calm down a little bit, but then every time I'd work out, I'd be sore for an extended period of time, and I'd notice it go into my hips too. And then so I was able to kind of manage it for the couple years after that. Then in 2022, that's when I started getting issues up here, the thoracic outlet issues.
Okay. And no MRI of the neck. They didn't want to.
No,
they didn't want.
I haven't quite got that far yet.
All right. It's the same story. It's the same story that I'm seeing here in the lower back. Usually repeats in the neck. Statistically, these last two guys, L4 and L5, and cervical 5, 6, and 7, end up having all the wear and tear. So I think it's really silly, really stupid, real quick that if all the wear and tear is happening here, well, it must be mechanical, right? There's something alignment and mobility where when you're bending, all the bending is happening here, and most of the bending is happening here. The nerves that come out of your lower neck go down your arms, the nerves lower back go down the leg. All right. The other further information maybe they didn't tell you was that it takes a minimum of 10 years prior to when you finally felt the disc bulging to when the disc was actually injured. Similar to a cavity in a tooth, it takes time for the cavity for the decay to form and for it to actually bulge out. So if you were 17 when you started feeling that, that means we're talking about a single-digit age injury.
Yeah.
That was the culprit. Otherwise, you would have felt it at 28 or later in the 30s. So something happened. Do you have a story?
Yeah. So,
something happened in your single-digit age.
I started wrestling when I was 6 or 7 years old.
Okay.
And started playing football when I was 9.
Okay.
So, I did that for probably 13 years each. And then just I've had numerous issues with my neck. Nothing that ever kept me out of competing or anything, but I always had, every once in a while in football I'd get whacked and I'd feel it in my neck. Or
my brother-in-law played football, and I know you guys call them stingers. You guys
are
so cute. What a cute word. You literally are mashing your brachial plexus, but it's oh shit, that's okay. It's just a stinger.
And then in wrestling, it's I'm like this, and then someone's constantly prying on your neck, trying to push it down.
We have two different types of stenosis. There is stenosis we call foraminal stenosis, which on that report, if you're wondering what that means the hole in the side is getting more narrow. So the actual disc supports open the height of that hole. So as the disc becomes more narrow, the height of the hole becomes more narrow.
Okay.
This will cause usually radiating pain down the leg, down into the hip.
Yep.
That's what we. If you hit this wire, it's like hitting your funny bone. You're going to feel it where the nerve goes. Canal stenosis means that if you're looking straight down on the body, there's the canal that the spinal cord is in. So the disc bulge is coming, if you're in a cross section, do you understand?
Yeah.
And so the actual canal tube is being stenotic, and so we have actual spinal cord pressure.
Okay.
This spinal cord actually has no feeling. When you start to hit the spinal cord, you start getting into numbness. Have you experienced numbness?
Yeah, I have. I've experienced, you talking just here or anywhere?
Anywhere.
Yeah, so I've gotten numbness into each hip. I've had each foot going numb in the toes too. I've had numbness, tingling
in the hands.
Yeah. And
this comes back, or does it stay? How long has it stayed numb?
I've woken up in the middle of the night to my whole arm going numb.
Sure.
But then I'll wake up and kind of move it around and it comes back. It's more so positionally.
Okay.
When I get to sometimes if I just stick my arm out like this, I'll get it all the way down through here.
Okay.
But usually if I'm just standing up straight, arms at my side, I don't really experience it.
It's good. I mean, the report, obviously this MRI was most likely taken laying down, right?
Yeah,
so
it was.
It's a little silly. Hopefully a chiropractor didn't order that. Because it's mechanically, the spine changes based on gravity.
Okay. Yeah.
And so this is the best it looks, and this is 4 years ago, and so it only keeps going, and then if you actually put weight on the spine, the discs bulge out a little bit more. So sometimes it can be disconcerting because it's like, well, my MRI says mild, but I'm like, I'm dying here. It's like, well, it's not giving a most accurate description of what's going on. So the treatment is to get the weight off the front part of the disc. So the tears, the annular tears, are most likely all accumulating the back side. So the more bent forward we go, the front part of the disc becomes compressed, the back side gets stretched open, annular tears form on the back side here. That causes the disc to start bulging out. We want to, instead of just straight tractioning you, we want to actually compress the back side and decompress the front side to restore that natural lordosis and bring you back into the normal position that your spine belongs in. This is where I'm not a big fan of inversion, even though, especially at young ages where the discs are soft and flexible, it'll feel good perhaps while you're inverting. My father was pretty injured by that kind of care. It felt great while he was being inverted, but then, have you done that to you?
Like inversion tables?
Yeah, or even just traction machines?
They have done traction machines,
What's your opinion?
I mean, I never really noticed anything good.
Yeah. Okay, well, I'm glad I think you didn't get hurt.
Yeah.
So that's because there's a potential for, the actual discs are actually glued to the end plate. So the part of the vertebral body actually connects to the end plate. So when I traction this, on the model it separates, but on the real life it wouldn't. That disc would stay attached, and this would stretch. The disc would stretch, and so the fibers of the annulus, if there's tears in them, I think of it like a piece of fabric. Right? If there's a tear in the fabric and you sit there and pull on it, it's not going to help it.
Yeah.
Right? You're gonna possibly tear it more as you keep pulling on it. So we want to. There are posterior annular tears that we want to compress. We want to actually approximate wounds on the posterior side, and then because this side's always so compressed because of the forward rotation of life and wrestling and football, loss of cervical curve, this side's always compressed. So we actually want to decompress the front side and compress the posterior side. We call this extension traction.
Okay.
And that's the difference between just straight positive traction where the whole disc is being decompressed, while we're actually trying to compress the backside and decompress the front. The nucleus of the disc shifts posteriorly because there's so much anterior discal pressure. It doesn't actually want to be near your nerves. The only reason it's forced there is because there's so much pressure on the front that's forcing it towards the back. So that solves that problem also by decompressing the front. The disc shifts away.
Yeah, that makes sense.
From the nerves. Yeah. Okay. There must be another part of your spine that's not working to allow your lower neck to overwork. And that's the goal of today's care, is we're going to work on your upper neck, we're going to work on your upper back. I expect to find a lot of stiffness in the adjacent areas, right? Many of your vertebrae, probably something like 80% of your back isn't injured, and 20% is injured, and most of the world is focusing on that 20%. I'm here to focus on the 80% that's not, and understand and answer the question, well, why is that not injured? It's not injured because it doesn't work. Doesn't mechanically function, and that's what we're going to find when I'm working on you and restoring its function and restoring your neck curve. Look straight forward. All right, so we're dealing with about 1 inch forward your head, and again, if I had to x-ray, how much of that cervical, you're supposed to have a 45-degree, won't be this way for you, like that, from that direction. How much of that 45-degree bend has gone ortho or straight, and then all the weight like a ladder goes, that's why the lower neck discs, the lower back discs, the loss of curve transfers the stress to the lower back. You flatten out our back, all the weight goes down the bottom when your back is supposed to have a nice arch in it. It's going to tell me everything here. Take a deep breath. Here we go. Go sit up on it. Let it all go. Exhale. There you go. Relax. There you go. Deep breath in. I got you, buddy. Exhale. There you go. Okay. One more. There we go. Yeah, I don't want to do that. All right, I've seen worse. I've seen worse. 70%, that's like a C minus. Like I maybe can give you a passing grade for that, but I'm saying it moved barely enough to where for a 22-year-old I expect a lot of suppleness in there. 26 is full skeletal maturity, so you got 4 years before the growth plates and the cement hardens, and it's going to get really more expensive to change stuff. Versus at your age right now, we can do a lot of work quickly here. Just forward if I know you're out of town, that nobody touches your lower back, okay? Just nobody. I'm not going to adjust you, but I'm saying nobody puts their hand on your lower back. If somebody starts putting their hand on your lower back, I want you to go, what are we doing? What is I need you to explain to me why we want to adjust. We have an MRI. It's right there. I got reports. I got 2 injuries. I got cuts. Why do people want to go in there and start pulling on the cuts in there? Why are you doing this to me? We're going to loosen the joint below and above. Okay, so I need to try to move some stress off that area. But you'll see in a second. Breathe for me. Exhale. Up here in the middle back, we're trying to loosen. Good. You understand? Up here, where it's not injured, deep breath, I got you. Exhale. And then gentle, not a huge body, just get the idea? Yep. Not a huge body slam. We're just trying to loosen the SI joint a little bit.
Yep, I've definitely had a lot of chiropractors before.
Don't be going crazy hard on that.
Yeah, they have.
I got you. Exhale. Up here. Good. Up there. Then here, breathe. Good. Get the idea? Yep. Right? All right. I didn't learn that on my own. Okay, that wasn't like something that just came to me. That came from my father living and having what you have, going to that type of chiropractic, getting injured, and then going to chiropractors like me that are helping him, right? And then having to decipher, well, why is that kind of thing helping me and why is that hurting me? Oh, it's anytime they go digging into my wounds, it makes me worse. And you're young, you don't need to be. We already have the answers. It's like Radio Shack. You've got questions. We've already got the answers. Let's not do that now. All right. Let me see here. Right atlas, big right atlas, gee whiz. Okay. And everything's over to the right. Okay. There you go.
Yeah, I haven't had too many people like actually work on my upper neck. It's all been like lower neck.
He's like, no.
Only people have been jabbing their finger into my cuts, trying to help the cut. It needs to be left alone. I'm sorry. All right, real gentle. Just up here, right at the top of the occiput. Easy. Okay, all right. All right?
Yep.
Your neck belongs curved. Your neck belongs here. It does not belong ortho. This is why inversion and straight traction I find to be a little silly, because it's like we're not helping aim the spine into a position that is conducive to making it to 90, right? I am, all my adjustments, all of the care that I do, I'm aiming your spine in the direction of the natural alignment, right? Where your body belongs, even though I can't change it by adjusting, right?
Yeah.
So as much as I wish it were possible, I could push a curve into your neck. That doesn't mean that I'm still not going to adjust your neck, taking the curve out. When I'm adjusting his neck, his chin is going up, and I'm closing the joint. Some junk adjustments you'll see on the internet, people have their chin down. Do you understand? Chiropractors will have the chin. I'm not going to adjust you. My point is that the chin is down, and then they'll rotate you. Do you understand?
Yeah.
With your chin down. See how much your chin's down?
Yeah.
Versus chin is up, because we're aiming the spine back into a curved position. I'm not going to open the joint by having the chin down when I adjust you. When the chin is down, there's more weight on the disc. You're flexed. You're in flexion. The disc is on the front. The more you flex forward, the more weight is put onto the disc. The disc does not heal. The discs do not replace. Joints do. And that's the whole point of why you can't have all the weight on the disc, because it simply won't make it to 90. So how do we undo it? Well, we have to clean up the areas that your body has desired to get away from, and when those areas aren't hurting, your body will start to utilize them and function in those areas and no longer feel the need to avoid them. And that's it. No more talking. That's it. It's just, there we go. All right.
I thought it was more for a quiet visit.
There we go. That's right. Hey, very good. There we go. That's
How long
right.
have you been watching them?
Well, at least a year.
Oh, cool.
That's right. It costs double. Costs double if you want me to be quiet. It's discounted if you let me talk. There you go. I should be on a t-shirt, babe. Costs double if you want a quiet visit. That and my new thing is you got to fight to stay upright. But where the Beastie Boys will get me in trouble. You got to fight for your right to stay upright. That's got to go.
Yeah, that'd be a good one.
Now what happened here? Felt a little knot there. Ooh.
Yeah.
That's a nice little ripple. You tore that. Good. All right.
Yeah.
You can sort of feel my thumb kind of moves differently over, but there's a knot inside. Think of like those drawers in a kitchen that you let go of the drawer and it's supposed to auto shut. Same kind of thing happens to these ribs. They're supposed to raise up when you breathe in, and then you exhale and the rib goes back down. There's ligaments are needed, healthy ligaments, not stretched out torn ligaments are needed for that to happen. Essentially, like that drawer in the kitchen, those springs that close the drawer get damaged, and so the drawer stays open. That position of the drawer staying open is one where the nerve can get hit, muscles have to work harder, it's a lot less stable.
Yeah, that makes
right?
sense.
And so that's essentially what I'm feeling right now. I feel like all the drawers, and I'm walking in the kitchen, all the drawers are left open.
Yeah, my traps have been just like stuck in spasm for 2 years.
Well, right, because the bone's not in the right place, and your muscles are guarding. He had to go cupping at home by himself to try to get some help, like Michael Phelps, huh? Remember that first time I saw it, it was like maybe 8 years ago. Michael Phelps had all those hickey marks across his chest, and all the announcers were like, "What's going on? What is that?" Like, none of them could speak intelligently about what the most decorated Olympic athlete of all time was doing.
Yeah. You should see the looks I get from my family and my friends. Like, if they see me with a cupping mark, they're like, what is that?
Why is that still? I mean, gosh, I thought Michael Phelps fixed that.
Yeah.
Oh, come on.
Yeah, like chest, like right in the my front delt there has been killing me for a long time too.
In here?
Yeah.
AC joint. Yeah, that's what I'm trying to say. This clavicle, what the? I don't know, something. Maybe just jammed. I feel like this is just jammed over here, and this needs to be stretched open. You go and be an athlete, you're going to have a car mechanic.
Yeah.
It's the way it works. Think of like the F1 drivers and those NASCAR and you got a whole pit crew. Where's your pit crew?
Yeah, exactly.
Oh, I do my own cupping. Ridiculous.
I got to get out of the car and change my own
Yeah,
tires.
change your own tires. It's ridiculous. Like, where's your mechanic? Okay, fair enough. Right there a little bit, yeah.
What causes all those like little crunchies?
Part of it is just, there's not much fat over the tissue, you understand? So you're actually feeling the muscle fibers.
Oh, okay.
So some people it'll be more, you won't feel it because there's a layer above it, but it's the actual muscle fibers, right? So some of it's normal and they're just real close to the surface. Some of it is scar tissue. When it's not smooth, right? This is smooth and then it gets to like more of a crunchier lump. That's sometimes an indicated tear or injury.
Okay.
Like the original collagen is very organized and lined up, right? So you're going to feel those fibers. Then if it heals with like a little bit of a tangle, and that's elevated. So you'll feel it's like a bump where it healed in a knot. And you can comb the tissue and get it like 90% back to what it was originally, and that's the goal of the care, is to recomb those fibers, get them flowing. All of that.
Yeah.
Think of it like a nerve right next to a cliff edge. It just takes one little movement and then you feel it zing, right? So that's a hypersensitization of the nerve. So as we clean your spine, as we balance your spine, it takes more to hit that threshold, right? So the amount of input that has to come in versus, I just turn my neck and I feel it zing. That's a really upset nerve and one that's, like I said, right next to what we call its action potential or its firing point. Right there.
Now we're getting purple. I was like waiting for my spot. That got purple fast.
bodies are buried. That's right. Where all the damage happened. Bombs went off in here. So the inflammation occupies space that shouldn't be occupied by anything. The nerve should occupy that hole that's being passed through. So all this bruising, inflammation starts to occupy, leaving less space for the nerve to, occupy by itself. The walls are coming in, and the room's getting smaller. The nerve is a grouchy person. Doesn't like, I had more space than this, years ago.
Which side seemed worse?
Both pretty bad. That's why it's supposed to go down both arms.
Okay.
Worst spot I don't like is that. But the biggest thing I don't like is that left upper, which is going to cause right lower symptoms. So this causes this. So to me, the right arm would probably have more monsters in it, but it's really the left upper part of your neck that's the cause. Whoa! What is that? Oh, gosh! Collisions. All right, fair enough. Do you think it's more down the right leg, or is it both about the same? Or the right hip? Same.
I'd say it's about the same, yeah.
I just have a feeling it's. So the left, I got more tightness. Usually that means the right side's going to eat it more, but just this right here is the worst spot.
Yeah.
Right there. Oh man. Get right in here, man. Oof. That is something else. No one should look at this and go, oh, feels pretty good. If anybody does that, you gotta get out of the building. Okay? They haven't rubbed enough backs.
Yeah.
Okay, fair enough. It just feels a little tight. That's all you can tell. It just feels a little tight. No, it's not. It's all crunchy. It's all out of position.
Yeah, they just have never seemed to focus on like the right spots.
Yeah, this is. Leave that lower back alone and just focus up here. You gotta guide your people that care for you. Say, can you help me clear this tightness in my chest and misalignment up here? Helping me get it looser so I can stretch it at home.
Mm-hmm.
Leave my lower back alone, please. I have injuries in there. I have disc injuries. I don't think it's gonna help them to be manipulating them. Let's leave those areas alone.
Yep.
And you'll be fine. You'll be just fine. As long as they leave those areas. Stop poking the bear.
Yeah, it's hard to find someone up where I live that like really knows what they're doing.
Dig in here, yeah. If anybody tells him that his core is weak, they need to be slapped. Correct. Well, I think the reason why your back hurts is just, I think your core is just not strong enough.
Yeah, I've heard that one before.
Oh boy, all right, well that's another reason to run. No, you need core suppleness. You have your core is over tight. It needs to be balanced and feel the difference here. I mean, this is much more normal over here. I mean, I got
Totally.
I'm not saying it's perfect, but it's a pass rating I would give on the right. And the left's just popped up. And, right, what the heck? No. That needs to be untangled and cared for until it no longer does. Reminds me of How to Train Your Dragon. You need to stop all this. You just gestured to all of me. Yes. Stop being all of you. Oh, this is a dangerous game you're playing. There'll be consequences. No, sorry. Another cut for the video.
No, it's hilarious. That's true.
Oh, it's right here. I'm searching for the bomb site. I'm searching for where the ground zero. Where's ground zero? Hit him right there. Yep. This is the main engine, so that just as the upper neck is analogous to the lower neck, the middle back here is the most public enemy number one for what the lower back is going through. So in a minute when we're on our back, this is where we're going to be focusing to restore your curve and also divert the mechanical bending point away from here, and we're going to make this area do most of the bending.
Okay.
And the rest of your life, you just learn to have a conversation with your middle back. The amount of care you will need will be based on how much and how able you are to stretch this area. If you're able to progress and do this at home, then you shouldn't need too much care. Ed, I can't take it. I hate the thing. It hurts too much. I can't do more than 5 minutes. See you tomorrow. Does that make sense? And so the care is simply there to make the stretching something that you can approach and manage and handle. That's really it. It's the stretching that will decompress the front part of the discs, stop them from continuing to bulge, take the stress off the areas that need to be taken the stress off of. But if I just throw people on stretches, do you see you'll just bend where you're loose?
Yeah.
You're not going to bend where you're stiff, and so you end up just getting hurt because it's easy to just keep bending where your back is already bending and where it's already loose. And so this is where, again, chiropractic comes into this equation to balance the spine first, and then we stretch at the end after your spine's been limbered up and it's moving better as a team. And then there's a pullback. Your body kind of looks at what I did today and says, yeah, I don't think so. You know, it's like trying to create a new habit, and your body's had habits its whole life, and then we're taking away the old habits, and I've never seen that happen easily or willingly. Your body kind of has to put up a fight as we create new habits, and that's the journey that I usually have with new patients. I work them through that phase of the new habits being formed, and then once the new habits are formed, you just have a nice life and do whatever you want to do with these other areas unlocked that the medical and chiropractic world call unremarkable, meaning that nothing's happened in them, but that unremarkableness is the problem. They're not being stressed, they're not functioning, they're just observing the game. Let's try to loosen up this top part of the hip a little bit here. This is the channel that the nerves, just like the channel in your upper back, the brachial plexus travels through to get to your shoulder. This is the channel the sciatic nerve has to kind of travel through to get down into your leg. And so if there's inflammation here, it's one of the first bottlenecks All right, take a deep breath in. Exhale. There it is. Okay. Get the idea?
Yeah.
Right? Arms down. Very good. I want you to help me try to lift your legs up, okay?
Yep.
Try to help me lift them up for me. Okay, good. Thank you. Now you can relax. I got you. All right, you can relax now. Breathe for me. Good. Okay. All right, that's good. All right, good. Okay. Yeah, leave that lower back alone. All right, up here. Oh man. Jeez. All right.
Oh, wow.
Right. So this is a channel. These are the nerves are traveling through that road there. So same thing on that left side. There's that. That's what I'm trying to say. That bomb went off down there. That's big cause for why. Set me back on your back for me. Beautiful. All right, fair enough. Really? Really? All right, done. There we go, good, okay. And then press back with your elbow. There you go, yeah, good. Go ahead. There you go, nice, yeah. It was a couch. Sure it was. Tilt your head left for me. Go ahead and tilt left. Very good. And tilt right for me. And then go and tilt right. Okay, good. Right over here about 20 minutes and you just, let your neck stretch and let it restore that curve. It's the opposite. End of the day is the premium time to do it, where you're trying to let this be the last thing your spine sees before you go to bed. To get off, you use one hand behind your head. You'll lift your head up, and then use your other hand to grab the device and pull it out, and then lay your head back down. And that's how you get off that guy. Try to not use your neck muscles.
Okay.
Especially,
let them relax.
Right. Especially after you've been on there for 20 minutes, your back of your neck might be warm or tingly. Let's try the bigger guy. Let's see if we can handle this. Lay back. I got you. 1 second. Easy. Lay back. Lay back. I got you. Yep. Try it. Let's try it. All right. And bend the knees for me. Okay. What do you think? Pretty important.
Yeah, I mean, I can handle this.
All right. Arms over your head. Let's try the arms up. There we go. Oh boy. There we go. All right, good. 22 is nice. I like that. I feel it. Is it a little looser?
Yeah, definitely. I definitely feel like even just that, like I can feel a little better right now. Feel like I'm.
Chest wants to open up now.
Yeah.
All right, bud. You did great.
Yep. Thank you.
Awesome, bud. Excellent.
Thank you.